pandemic in the country and then be available to take questions. But we very much appreciate the attendance of all who are here and all of you who have made time to tune in. As we reported today, we have now more than 2,500,000 Americans that have contracted the coronavirus. And sadly, we've lost more than 126,000 of our countrymen to this disease. And I know I speak for the President and for every American when we express our sympathies and our deepest condolences to all the families who have lost loved ones. Despite those losses, since the end of our 45 days to slow the spread and the beginning of efforts to open up America, thanks to the cooperation of the American people, the efforts of governors and state health officials, efforts, I want to proudly say, of the entire federal team under the leadership of President Trump, we have made truly remarkable progress in moving our nation forward. And local officials are directing will be our continued strategy. Dr. Fauci, did you want to respond?
Sure. So what I meant by what is not working, and this is not anybody's fault or any institution's fault, is that what we're dealing with right now is community spread in the context of a substantial proportion of the people who are getting infected do not know they're infected, they're not symptomatic, they're asymptomatic individuals. The classic paradigm of identification, isolation, and contact tracing to actually contain that is very difficult to make that work under those circumstances. You superimpose upon that the fact that even with identification, isolation, and contact tracing, often the dots are not connected. If you get on the phone and talk to people who are in some of these communities, you find that a lot of it is done by phone. And when it's done by phone, maybe half of the people don't even want to talk to one who they think is a government representative. If you live in a community that is mostly brown or black, you're in a different situation that maybe 70% of them don't really want to talk to you. You can identify a contact, but you don't isolate them because you don't have the facility to isolate them. That is what's not working. So what we're going to do, and we are doing, and you're going to be hearing about this, flooding the area of a community to get a feel for what's out there, particularly among the asymptomatics. So in other words, it's a paradigm shift because we're dealing with young people, people who are going to be asymptomatic, and people who are getting infected in a community setting, not an outbreak setting where you know who to identify, isolate, and contact trace. Right. That's what I meant. So let's take a look at this problem that we're facing now, this resurgence of cases. I don't think there's time enough now all day to try and analyze and figure out the multifaceted elements that went into that. Everything from maybe opening a little bit too early on some to opening at the right time, but not actually following the steps in an orderly fashion.
You're telling people to listen to local officials, but in Tulsa you defied local health officials to have an event that, even though you say it didn't result in a spike, dozens of Secret Service agents, dozens of campaign staffers are now quarantined after positive tests. And then in Arizona, one of the hardest hit states, you packed a church with young people who weren't wearing masks. So how can you say that the campaign is not part of the problem that Dr. Fauci laid out?
Well, I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States. And even in a health crisis, the American people don't forfeit